Hello, everyone. Thank you for joining us. We are live from Houston, Texas. I'm Dr. Deigni. I'm a board certified plastic surgeon, and I specialize in body contouring procedures. We're going to be spending an hour tonight talking about these different procedures. And if you've been thinking about getting plastic surgery, by all means, let us know. Send us a message. There should be a form in the bottom left of the screen there. Put in your information, what procedures you're interested in, and we will get back to you. You can also save this number in your phone, or better yet, call us or text us. We will respond as soon as possible during business hours. But just text us to 281-724-3138, and we will be happy to get back to you. It's always a pleasure to meet you guys in person. We typically will start with a virtual consultation because the majority of you are out of town, out of Houston, outside of Houston, also out of Texas. And some of you are actually in different parts of the world, including Canada, Mexico, and other countries. So we're always happy to start with a virtual consultation for you and then get you in the books for your in-person visit and surgery. All right, starting us off is Shania Paul. Thank you very much for the question here. Do I need to lose weight before I get one? I'm 165 pounds and 5'7". Great. So the main thing is we want your BMI to be 35 or less. At 165 pounds and 5'7", you will definitely be below that. The maximum weight, if you're 5'7", is 222 pounds. So you're definitely well below that maximum weight. And we will be happy to take care of you. You do not need to lose any more weight. So contact us, send us a text. That's the easiest, actually. And my patient coordinator, Claire, will be happy to respond and guide you through the process. Thank you very much for your question. Stay tuned as we will be talking about many other procedures and also topics as the questions start to flow. One other main topic is people who will ask me if they are too old to have surgery or if there's an age limit. For example, they'll tell me they're 54 years old or they're 60 years old. Is that too old for them to have surgery? It is not. So age is not the limiting factor. I look at your overall health. I've operated and done these big body contouring procedures in patients in their 50s, 60s, and in their 70s, and they have done very well. Of course, I operate in patients in their 20s, 30s, and 40s as well. So definitely need to guide you through the process and discuss further. And we look forward to meeting you. Shireen Pinks, good night. Yes, hello. I'm 212 pounds and 5'6". So at 5'6", your maximum weight would be 216 pounds. So we need you to lose at least 6 pounds, which is fairly easy. You should be able to lose that within 2 weeks, or at least, at the very least, a month. Ideally, I would like for you to lose maybe 15 to 20 pounds. That would be to your advantage to decrease your BMI and get you back into the zone where we can decrease your risk of infections and surgical wound healing problems and also complications. No problem. Text us. We will be happy to guide you. You're very close. You're 6 pounds away. If you can, give us 15 pounds, go the extra mile. We'll be happy to take care of you. Okay, Hayes 3 is saying 5'3", 200 pounds. That's too high. Again, what we want you to do is check your BMI. Your BMI has to be 35 or less. So 5'3", your max weight should be 197. 200 pounds, you're about 3 pounds away. So you're very close to your BMI of 35. Again, I would like for you to lose maybe another 10 pounds. 10, 15 pounds, that would get you maybe to a BMI of like 33 or 34, which is better than a 35, but very close, and we can definitely get you in for your surgeries. Contact us. Easiest way is just send us a message. We will respond during business hours. Of course, tomorrow is a holiday for Independence Day here in the U.S. So we will be out of the office and back in the office next week, Monday. But definitely call us, leave a message. or send us a text. That's the easiest way. You can also put your information in the bottom left of the screen there. We should be able to respond as well from there. Gloria Brown 745, does insurance cover it? No, insurance does not cover any of these procedures that I do. All of my patients pay out of pocket. We do not take insurance because insurance doesn't cover these procedures. We do offer financing options. We offer 4 of them. Hello, our mentor is Victoria. Thank you very much for joining us. Go ahead and post your comment or your question, okay, and I'll answer it. We offer 4 financing options: Care Credit, Alpheon, Patient Fi, and Cherry Financing. We really like Cherry Financing because it does a soft check to your credit score, so it doesn't affect your credit score at all. But it definitely gives you some very quick results to let you know how much you would qualify for fairly quickly. So text us and we will be happy to guide you through the process, okay? Antonique 71, 6 foot, 188 pounds. You would be definitely below the BMI of 35, and you would qualify as long as you don't have any medical conditions that would prevent you from having these surgeries. You will qualify for me to do your surgeries. So send us a text message, 281-724-3138. Let us know what you're interested in having done, and we will get back to you. Hey, Jack Marie, how are you doing? Happy 4th of July to you and your husband. I hope all is well. Bonded by pause. Can you do a reverse tummy tuck on local anesthesia? 28 years old, 125 pounds, and 5'2". That might be asking a little bit too much. Definitely, we can do some procedures under local. Not everybody qualifies for it because not everybody is actually comfortable enough to be able to stay still while we do these types of procedures. I probably wouldn't do a reverse tummy tuck depending on how it is on everybody under local. I'd probably put you to sleep. But again, it could be done. Just like I do a mini tummy tuck on certain patients. Not everybody qualifies for it, but I can do some. On some patients, I will do it with them awake in the office. So it all depends. Contact us and we'll go from there. All right, everybody's giving us their height and weight. Let's see, Golden Gotti, 5'4", 196. So at 5'4", yes, you will be right below that BMI of 35. Again, I would want you to probably lose 5 to 10 pounds at least. That can be done within a month and a half. But you definitely will qualify even now because you're below that BMI of 35, and we will be happy to take care of you. Send us a text message, 281-724-3138, and we'll get the process going. Deshaun Murray, 6'58", 5'11", 238. So at 5'11", 238, you're right under that BMI of 35 as well. Everybody today is right at that cusp of just below BMI of 35. Ideally for you as well, I would like for you to lose 5 to 10 pounds. That's fairly easy. Within 4 to 6 weeks, everybody should be able to lose about 10 pounds. It's to be able to get you in a safer zone again, all right? The higher your BMI, the higher the risk of wound healing problems, surgical complications. And we want you to be able to go through these procedures safely and recover well and enjoy your life, as well as the beautiful results that we give you. So, but barring any medical conditions that would prevent you from having surgery, you are also a candidate for these procedures. So send us a text message, 281-724-3138, and we will be happy to take care of you. Hi, Kaida Porvita. Thanks for joining us. Go ahead and ask your question, and I'll answer it, okay? Okay, somebody was asking, do I provide free consultations? No, we do not have free consultations, Lois. Hunter, our appointment booking fee is $150, and we will start with a virtual consultation if you're not in the Houston area or able to come to Houston to see me in person, and we will do a virtual consultation fee. 5'1", 127. Yes, you will qualify. We'd be happy to take care of you. Momo F. Many. Mom of Many, sorry. Mom of Many. Yes, come in and see us. We'll be happy to take care of you. 5'11", 271. 5'11", 271. That's a little bit much. We'd have to get you to lose some weight to be able to get you to a BMI of 35. Again, just go on. So everybody's giving me their height. Just go on Google, type in BMI calculator, put your height and weight, and you'll see what your BMI is. We want it to be less than 35. Okay. Shy, do you do loose skin removal? Absolutely. I've been doing quite a few of them just this week. We just did two of my patients yesterday had complaints of excess loose skin in the arms. Another one had some loose skin in the bra line area. So for one of my patients, I did the combo arm lift and bra line lift. And the other patient was the arm lift. Today, we have a patient who also has had massive weight loss, has a lot of loose skin all over around her body and in the arms as well. So we did, again, an arm lift combo with a body lift. So the body lift is a combination of actually the drainage tummy tuck, so I can fix the area of the belly, the hip lift, so I can take care of this area where there's a lot of loose skin and sagging, and you can see how it kind of dips and sags. By just doing the hip lift and butt lift, I can actually give very nice contours. There's no liposuction, no fat transfer, just surgical excision removal, cutting out things, and then draping things nicely with the techniques that I use. Gives her beautiful contour, and she's thrilled and very happy. So that's what I did with my patient today. So I operate on patients who have massive weight loss, who've had massive weight loss and have a lot of loose skin around their body, and we take care of them, absolutely. So send us a text, 281-724-3138. We will be happy to take care of you, and we look forward to it. Jeannie McDaniel, 5'6", 219, you would qualify for you're 3 pounds over, but you're very close. So lose another 5-10 pounds and we're good to go. As long as you don't have any medical conditions that will prevent you from having a surgery, we will be happy to take care of you. So send us a text. You're pretty much right there at the BMI of 35, so we can move forward with surgery. Carolyn Cooper. I have high blood pressure and I'm a smoker and a smoker. Am I a candidate? So we need to make sure that you quit smoking and also that you're on appropriate blood pressure medication to control your high blood pressure. I've operated on patients who were smokers and had high blood pressure. We controlled those two factors. We did their surgery. They did very well. So we just need to make sure that those two steps are taken care of and that you don't have any other medical conditions, and we'll be happy to take care of you. Send us a text message, okay? Forever me, I just want lipo in my stomach. Okay, we can do liposuction, not a problem. So I specialize in many, many different procedures, and we're always happy to be able to provide specific care and tailored treatment plans for our patients. So if you want liposuction just in the belly area, we're happy to provide that for you. Louis Hunter, great, you're welcome. Thank you so much for the information. You're very welcome. I appreciate it. Looking forward to seeing you. Thank you very much, Elizabeth Barnes, for sharing this link, the NIH, to calculate your BMI. If you guys use that link, you'll be able to put in your information and see what your BMI is. And we want it to be less than 35. Fala Axad, I'm not sure how to say that, sorry. How much is the cost? So the surgeries will vary anywhere between $20,000 and $35,000 or more for the body transformation. So when you're including multiple procedures. Right now, we're running a special for just under $20,000 for the combination of a breast lift and the drainage tummy tuck and the fupa area, the monsplasty. And that's a typical mommy makeover for the majority of patients. And that's just under $20,000. So text us, call us, and we will be happy to get you in for that special. 52140, perfect. You'll be just fine. We will be happy to see you, Jenny, on Rio. Contact us and send us a message, and we'll get the ball rolling for you. Can you do a tummy tuck without the belly button removal? No, you have to you have to displace the belly button if you want to do a tummy tuck. If you do a tummy tuck without removing the belly button, essentially that's a paniculectomy. In other words, I would just cut the excess skin that's just in this area and also do the fupa repair. It won't be able to fix anything up here because you have to release the belly button so that you can actually pull that skin down, drape it over the belly button, and then make a hole for the new belly button. Great question. Oh, wow. Sherry Glover. Thank you. Wow. 5'5", 177. Yes, at 5'5", 177, you would definitely qualify for surgery. You were 326 pounds, had a gastric sleeve bypass. Congratulations on your weight loss. We will be happy to take care of you, remove all of that excess skin that might be bothering you and causing some discomfort and difficulty even exercising and finding the right wardrobes. Contact us. We are happy to take care of you. We love being able to make those huge transformations for our patients. Dima, thank you for joining us again. Ask your questions and I'll be happy to answer them, okay? All right. Are you saying this is covered by insurance? No, no. Insurance does not cover any of these procedures. So our patients pay out of pocket. But we do offer financing options for our patients so that they can actually take advantage of those. Contact us and we'll be happy to guide you through that process. June Dior is saying, how much is the arm lift? I don't know the price of the procedures, but my patient coordinator has it. So please go ahead and contact us. And we'll be happy to guide you through the process, okay? Any higher BMI options? No, my max BMI is 35. That's the blanket general statement. I've operated on patients who have higher BMIs, but it's on a case-by-case basis, depending on what surgery you want to have done and where they carry that weight. So we can always discuss that as well. But in general, it would be a max BMI of 35. All right. Grace, I'm in Canada going in for gastric sleeve surgery. Sorry, I'm trying to get to the question. When can I go for the lift? Usually it will take about a year. It takes about a year for your body to lose that weight, stabilize, and maintain that weight for several months, and then you can move forward with the skin removal. So, wishing you well. Hope that everything goes very well for your surgery and your recovery, and we look forward to taking care of you. You can contact us probably within the next 9 months. That way, we can plan for your surgery and make sure that everything's going well, and then we'll get you on the books for your body transformation. Alicia S., do you do full body lifts? Yes, I do. I've lost 150 pounds and I've had 4 children via C-section. Absolutely. I do full body lifts for everybody. For the majority of my patients who want the full body lift, we have to stage it because it's going to be way too much surgery to do it once for your body to actually recover well. So usually we'll stage the procedures. It could be 2 stages or 3 stages if you want really the full transformation. So contact us, send us a text, and we will be happy to take care of you. Naomi, thank you for joining us. Hope you're doing well. Send us a message, post your question. I'll be happy to answer. Okay. Sorry, Wegovy injection for weight loss. Explain, please. I'm not sure what you want me to explain, but if you are on any kind of GLP-1 medication, we want you to stop your medications usually 3 weeks before surgery, and then we can go ahead and proceed with these body transforming surgeries, and then we'll get you back on your medications usually 2 weeks after. All right. You're very welcome, Chair Glover. Thank you guys for participating and asking your questions. I hope you guys are getting some value out of this. I do these live sessions every Tuesday and Thursday, time permitting, and I'm happy to be able to share this information, give you as much information as possible so that you can be well informed and pick the plastic surgeons that you would like to have operate on you. And we hope that you will choose us, but definitely there's plenty of great plastic surgeons in the US. It's good that you are well educated, so please do your due diligence, and we wish you well. Raven Saunders, I have terrible lumps from aggressive lipo. Okay, will a tummy tuck help that? It depends. I need to see you. I need to see what your body presents uh, with. When I examine you, I'll be able to see and have a better idea of kind of like what your excess skin is like and where the contour deformities are, and I can let you know what will be the best procedure for you. Shai, what is the general recovery time for the body to 5'4", 175? Okay, so at 5'4", 175, sure, you would qualify for this. For my patients, I do the drainless technique. So my patients don't have any drains at all. I just saw a post today on one of the Facebook groups for tummy tucks and stuff, and somebody was kind of asking how people who have drains have recovered, because they've been draining, I think, for like 2 weeks now, and it has not stopped. And it's kind of like very bloody. So definitely there's something going on there. They have to go see their plastic surgeon to see what's going on. Maybe there's a hematoma that they missed. Regardless, when I do my procedures, I don't place any drains because of the technique that I use. I close everything up with meticulous stitching. I take the time to really close the spaces where the fluid could collect. And so that allows you to recover much faster and have a much smoother recovery. You're able to walk upright within the first 3 to 5 days after surgery, versus 2 or 3 weeks when you have drains. And also, it allows you to not have to focus on emptying drains, getting them caught. When you're showering, where do you put those drains, where you clip them? It's very awkward. You have none of that. It makes you makes your recovery much easier, and you don't need skilled nursing facilities at all, or even a skilled nurse to really take care of you. So the recovery process is usually 3 to 5 days. You're off your pain meds. You're walking upright. You come back to see me within a week. Then usually that second week, you're back at work. You're usually driving yourself at that point, and back in the gym at 2 to 3 weeks doing light aerobic activity. And then at 4 to 6 weeks, you're in the gym doing resistance training, start light, and then increase. And by 2 months, you're off any restrictions. So it's a very quick recovery with the procedures that I do and the techniques that I have. Very good. Santé 938. If you're 165 pounds and want to do a tummy tuck and an inner thigh lift, what do you suggest? So it depends on what your height is. If you're definitely below the BMI of 35 and you qualify for surgery, we can definitely have you come in. We'll take care of you. It depends on what type of thigh lift we need to do. I've combined the thigh lift that stays with the scar that stays in the groin with a tummy tuck, and my patients have done well. Usually, if we have to do the thigh lift where the scar goes from the groin all the way down to the knees, because we have to remove a lot of skin and fat and tissues. I usually don't combine that with the tummy tuck because it is a much tougher recovery process with the lymphatic distribution that's been displaced and everything. So it's a much harder recovery. So usually I'll stage those. But come and see us and we'll be happy to guide you through the process, okay? Text us. That's the easiest way. Our phone number, like I said, is 281-724-3138. Thank you for your question. Stomach lift. A stomach lift. Oh, okay. So you're on Wegovy and you want to know if you can get a stomach, like a tummy tuck. Yeah, so I'll take you off the Wegovy 3 weeks before surgery. We do the surgery, and then 2 weeks after you get back on your Wegovy. Not a problem. And I've operated on many, many patients who've been on GLP-1s. We also have a weight loss revolution program where we put our patients on those medications as well. And we have a protocol, just like I said, 3 weeks before and then 2 weeks after you get back on it. They call me Murda. What's a hip lift? So the hip lift is for when I do surgery to actually treat this excess loose skin in this area. So people will have cellulite and a lot of loose skin, and I lift that hip. So it's an extension of the tummy tuck. It goes all the way around the hip and then finishes over the butt area. So that's a butt and hip lift that really takes care of the outer part of the thigh. So you can see how she has these indents. The contour is very different. I cut that, pull things up, and it gives her a very nice look as if I had done a BBL on her, but I didn't do any liposuction and I did not do any fat transfer. It's just a technique that I use to really get her to round out. So beautiful contours, very nice surgeries, very nice results. It's actually cool. When can you do a round 2 liposuction? Usually I'll have you wait at least 9 months before we go in for like a full round 2. All right, very good. Thank you very much. You're very welcome, June Dior. Thank you for asking your questions. Everybody with your BMIs, please check and see what your BMIs are. Grace, how many hours does it take for the tummy tuck? On average, it's about 2 to 3 hours of you being under general anesthesia. Everybody's different. Some patients may have had previous surgery, so there's a lot of scar tissue, so it takes a little bit longer. That's kind of like the general range. So for those who haven't had any surgery, things are pretty straightforward. They don't have any hernias that we need to repair. Usually around 2 hours. For those of you who had surgery, you have a couple hernias that I see when I open up. If you have a lot of scar tissue, it takes a little bit longer. Usually that's a little bit more towards 3 hours. But as these are all same-day procedures, you go home the same day, or you leave the facility the same day. If you're out of town, if you're from out of town or out of state, what you will do is usually stay overnight, depending on how far you are. And so you'll leave the facility and go either to a hotel or at your friends or family's home, or you can get an Airbnb. Aruja Mad, how do you guys do mastopexy? Yes. So that's the medical term for a breast lift. Absolutely, we do breast lift surgery for our patients who need that. So contact us. We'll be happy to get you in for your consultation, and virtually if you're out of town, out of state, or even out of country, and then we'll get you in on the books for your surgery. Miss Silk, I'm a truck driver. When can I go back to work after a tummy tuck? So truck driver, as long as you're not doing any heavy lifting, I think for you probably at 2 weeks, at that 3rd week, because the technique that I use allows you to have a much faster recovery. But as a truck driver, you're going to have to, get onto your truck. So I'm not sure what steps you have and things like that. So I want you to wait at least 2 weeks to be able to safely get onto the truck. You'll be off your pain meds usually within 3 days. You'll be off of them. Most of my patients wean off their pain meds around 3 to 5 days. 3 days is kind of like the average. You're walking upright by the time you come back to see me as well in the office, usually 1 week after. And usually after that, you're free to go back to work. But for you, specifically for a truck driver, I'll probably wait until that 2nd week. So it's fairly quick. What's the BMI limit? BMI limit is 35. Nothing more than 35. That's the blanket statement. There are cases where I will do some surgeries on patients who have higher BMIs, but it's on a case-by-case basis. Oh, yes. Blue and gold. Wish I had known more of the cons after surgery, drains, pain, depression, all that stuff. Absolutely. I don't do drains. So that removes all of that difficult part. And definitely always happy to take care of you guys. All right, Aaron Fetch. I'm 5'3", don't need any lipo, just have loose skin on my tummy from childbirth. What would that be? Yeah, a tummy tuck. So come in and see us. We'll be happy to take care of you. Sanji, Massachusetts, yes. You would have to come to Texas. Absolutely. Come and see us in Texas. We will be happy to see you. I think somebody had asked something about the Midwest. Sorry, I missed that question. I know the feed keeps going up, so I may have missed your question. If I missed it, please go ahead and repost so that I can see the question in the feed, and I'll be able to answer it. I'm 55 years old, Gen X 1970. I'm 55 years old, a type 2 diabetic, but my blood pressure is under control. I'm 5'3" and 155 pounds. So 5'3", 155 pounds, you would qualify. You're type 2 diabetic as long as your hemoglobin A1C is 7 or less, and your blood sugars, you said your blood sugar is under control, you're good to go. We will be happy to take care of you. I've operated on diabetics quite often, and we make sure that everything is medically optimized, and then we can move forward with that. Shireen Pinks, do you do lipo on the backs? Yes, absolutely. We do liposuction of the back as well. We do backs. So lipo 360 for me is abdomen, so belly area, love handles, back, bra line. All of the torso area is what I include in the lipo 360. Thank you very much, Jackie Marie, for encouraging them. Absolutely. And thank you for answering those questions. I appreciate that. For pricing, everybody, please go ahead and contact us. My patient coordinator will be happy to get you guys some information and some estimates for your exact quote. We will give you that once we've done the consultation, so I know exactly what treatment plan we're going to be doing for you specifically. Because like I said earlier on this live, we want to tailor the treatments specifically to your needs, your body, and what you are wanting to have done. So it's not a cookie cut type of process. So text us. Anybody who's interested, please go ahead and text us, and we'll be happy to take care of you. This is our phone number, 281-724-3138. Divine Femme. Can you discuss lipo? Yes, liposuction is a technique that we use to remove fat, stubborn fat in the subcutaneous area. So subcutaneous means just below the skin. So some people will ask, do you remove visceral fat? Visceral fat is fat that's inside your body, around your organs. We don't remove that. The only way you can target that is by diet and exercise and losing weight. So the liposuction that I do, I use small poke holes, and then I put the cannula inside and then remove that fat to really give you a nice contour. And that's what liposuction is. And that it is a very powerful technique to actually be able to remove that stubborn fat, give you some nice contours. The other thing with the liposuction is it allows me to actually get that fat. And then with that fat, I can transfer it elsewhere to give you even more curve. So for example, if you want a BBL, which is the Brazilian butt lift, I will transfer the fat to your hip dips and the butt area to give you more contours there. I can also transfer the fat to the breasts if you want more volume to your breasts. A lot of women will complain of loss of upper pole fullness, especially after they've had children, they've breastfed, and then the breasts start to sag. Usually we'll do a combination of a breast lift, and we can do fat transfer if you don't want the implants. We can do fat transfer to the face. That's something I do quite often as well. For my patients who want to have some rejuvenation of the face, I can fat transfer the back of the hand as well. And I can also transfer, some of my patients will ask for some fat transfer to the labia majora because they feel like their lady parts have deflated, have lost their plump and fullness and youthfulness. And so we go ahead and use that fat there as well. So we can do a lot with that fat from the liposuction. Okay, Divine Femme, can you fix hip dips? Absolutely. So with that liposuction, like I said, I harvest that fat and then I can fix the hip dips and put the fat right there. Miss Brown Sugar is asking, can insurance cover this procedure? No, unfortunately, insurance does not cover these procedures. All of these procedures that I do are considered elective cosmetic procedures. And so my patients pay out of pocket. Insurance doesn't pay for it. So we do offer financing options for our patients. We have 4 of them: Patient 5, Cherry Financing, Care Credit, and Alfie. So contact us and we'll be happy to guide you through it and take care of you. All right. Jessica Reed, what's an average price for a 360 mom lift type deal? Not sure what it's actually called. So the body lift surgery. It's in the mid 20,000s, if I'm not mistaken. But definitely contact us. My patient coordinator has the pricing, and she'll be able to give you an estimate of what the cost would be based on what procedures you want to have. I do know that our drainless tummy tuck by itself, so nothing else. The drainless tummy tuck is between $13,000 and $15,000. Right now, we're running a special for the combination of the drainless tummy tuck, the breast lift, and the monsplasty, so the FUPA repair, for just under $20,000. So definitely contact us, and we'll be happy to give you that special. Yes. So they call me like the saddlebags. Yeah, so that's the hip lift that does that. The saddlebags, yes, the hip lift will actually lift that up and really help that. What about lipo, doctor, and BBL? Yes, I just talked about that. Liposuction and the BBL. The BBL is the second phase of, so liposuction is the first phase of the BBL. The fat transfer is the second phase of the BBL. Thank you for your questions. I appreciate it. Okay, face over fear. Price for the tummy tuck with muscle repair, it's between $13,000 and $15,000. Yeah, and I do the drainless tummy tuck. The drainless tummy tuck is very powerful because it allows you to heal a lot faster and much easier, have a much better recovery. Hey, A2 Alexis, thank you for joining us. Just post your comment or your question, okay, and I'll answer it. So the drainless tummy tuck allows you to have a much faster recovery than the traditional tummy tuck where they put drains in. Shardizzle, are you able to do thigh lifts? Yes, absolutely. I do thigh lifts, and you can scroll through my TikTok feed and you'll see some results from beautiful thigh lifts that I've done. Patients who've left their testimonials very happy. There are two types of thigh lifts that I do. There's one where the scar stays hidden in the groin area and we treat just the top part of the thigh because that's where most of your skin excess is and your fat that's bothering you, kind of like when you're walking and you feel like there's rubbing. The second type of thigh lift is when the skin goes, the excess skin and fat goes all the way down to the knees. So there's a lot of tissue that needs to be removed. So in that case, the scar goes from the groin and then it extends down the inner thigh and goes down and up to the knee area. That's a bigger thigh lift, a much bigger procedure. But those are the procedures that I do to give my patients some beautiful results. So definitely contact us, send us a message, 281-724-3138. That's the easiest way to get a hold of us, and we will get back to you, okay? Appreciate everybody following and sending out and sharing the link. Snara0610, you're only in Texas. Yes, I am. I'm in Houston, Texas. And our patients come in from all over the US and even from outside of the country. So they fly in, drive in, and come and see us, and we take care of them. So Andrew's asking, does insurance cover body lift for someone who's lost 125 pounds? Unfortunately, no. Insurance does not cover any of these procedures. They consider this to be cosmetic surgery. So these are elective and not medically necessary. And so they do not cover any of these for patients. We do offer financing options for our patients. So you're welcome to take advantage of those as well. Devine Pham, I've had surgery with fibrosis developed recently. Oh, okay. Well, let us know what surgery you're interested in, and we'll be happy to take care of you. Rohina, what are the side effects of the surgery of the body lift? There's no side effects. There are. So as you recover, there will be some areas in your belly where you will have lost the sensation, and usually over time you'll start to develop some sensation back. Other than that, I mean, there's always risk. There's risk of bleeding. There's risk of wound healing problems. There's risk of seroma, which is a fluid collection. So those are risks of the surgery. But once you've healed well and done well, there's no side effect from that, other than probably you'll have to change your wardrobe and start wearing fitted clothing and looking really nice and hot and enjoying your life. That's the side effect of these surgeries. My BMI is 25.1. Fantastic. You will definitely qualify for surgery with us as long as you don't have any medical problems that will prevent you from having any kind of general anesthesia. They call me Murda. Can you do a tummy lipo and arm lipo at the same time? Yes, absolutely. We do that all the time. So again, that's like we can actually do lipo 360 as well if you want the love handles taken care of, the back, the bra line, and the arms, and even the inner thighs. We can do all of that in one day, in one surgery. All those procedures, not a problem. So contact us. We'll be happy to take care of you. Marquis 6, week 9, swollen and feel like it's gonna pop. When I lay on my side, the swelling goes to the side. So you're still week 9. That's really far out. Definitely go see your surgeon. There may be a seroma. They may be missing something. So they need to see you and see what's going on. Okay. Nikki Hamilton, BMI 39, tummy tuck 10. Is this safe? TT10. I'm not sure what that is. BMI of 39 is high. I would have you lose weight to get to at least a BMI of 35 before you move forward with a tummy tuck. Okay, Marky Six. Thanks for posting your questions multiple times because I'm just now seeing those. So good. Miss Brown, is it possible? Um, where did the question go? Is it possible for insurance to cover a portion of the tummy tuck? You'd have to ask your insurance what benefits they offer. A few insurance companies will cover what is called the paniculectomy part of the full tummy tuck. We don't take insurance. So if you want us to be your surgeon, we'd be happy to take care of you. You will pay us out of pocket, and then you can discuss with your insurance. Usually you do that before so that they actually let you know if they will reimburse you or not, and they will reimburse you directly. But we don't take insurance. JS Free. Um, 2017. What does the price? Oh, the prices. So the drainless tummy tuck is between $13,000 and $15,000. We're currently running a special for a mommy makeover, which includes the drainless tummy tuck, the Mons Plasty, which is the fupa area, and the breast lift, and that's just under $20,000. And then these body lifts usually will be around $25,000, and they can go up to $35,000 or more, depending on everything that you put on. If you're breast work, liposuction, BBL, 360 tummy tuck, people have different needs and have different bodies. And when we examine them, there are different areas that they want to have done, and it can include as many as possible in a safe time frame. And I will discuss that with you specifically because, like I said, everybody's different. But we'll make sure that we select a treatment plan that will get to your main areas of concern safely. And then if we need to do 2 stages, we'll do 2 stages to be able to get you the best recovery process possible, and then get you safely to enjoy your results. Sammy, estimates on tummy tucks, $13,000 to $15,000. Contact us and we'll get you in and take care of you. Okay. I'm 5'4" and I want to get lipo and get rid of my hip dips only. What would you suggest? Okay, come in and see us. What I'll probably do is most likely do some liposuction, so a lipo 360, and then be able to get that fat. And I will inject the fat around your hip dips to be able to contour those. So come and see us and we'll be happy to take care of you. I'm 66 years old. Would last still be a candidate for would I still be a candidate for tummy tuck? Yes. So as long as you're healthy enough to undergo general anesthesia, we'll be happy to take care of you. I've operated on patients in their 60s and 70s. I've done these big procedures on them, and they have done very well. As long as you're healthy enough, we can move forward. So 66 is not a contraindication. It's your overall health. Is the consultation free? No, it's $150 to book your appointments, whether virtually or in person. Very good question. What is the max BMI? Max BMI is 35. I am 57, not sure about a tummy tuck. What are our options about skin tightening? It depends on what you present with. I have to see you to be able to give you the appropriate treatment plan for your specific body. So come in and see us, schedule a consultation with us. If you're in the Houston area, we'll see you in person. If you're not in the Houston area, not able to come to us in person, we will start with a virtual consultation. I texted last week and didn't get a response. Okay, sorry about that. Please send us a text right now, or even fill in your information in the form as well. Do both, and we'll make sure that we get back to you, okay? Just doing. I'm 5'7" and 215 pounds is my highest, and my weight keeps going up and down. What do you recommend? So at 5'7", your max weight would be 222 to qualify for surgery. So at 215, you are just right under a BMI of 35, so we can definitely have surgery. However, you're asking about your weight keeps going up and down, so it's fluctuating. I would say, many things you can do. You can see your primary care doctor to see if there's anything medically that can be done. If your thyroid is having problems, things like that, you can go see a nutritionist. You can get a trainer, or you can really get, I don't know if you exercise or not. You can change things in your lifestyle to try to get that weight down. Those are multiple options that you can do. If you want to have surgery with us as well, you can come in and see us, and we can see what needs to be done for your body contouring. Okay, so Clarissa is asking, why no drains? What about fluid collection or hematomas and stuff like that? Great. So that's a great question. That's the whole purpose of the technique that I use. It actually decreases your risk of not hematomas, but of seromas. Hematomas is mostly either a blood vessel reopens. So whether you have drains it or not, it's not really going to decrease that. But it does decrease your risk of seroma if you have the drainage technique that I use. So let me clarify for you. When I do the tummy tuck, there's the traditional way where you put drains in, and you usually keep them for about 2 to 3 weeks and then remove them. And then there's the drainage technique that I do, where there are no drains. Okay. Now, drains, no drains. I'm not using the traditional technique and deciding not to put drains in. If you do that, you will be 100% guaranteed to have a seroma. The drainage technique is a technique where I actually put meticulous suturing, and I do close all of that area so that your tissues start to heal from day one. In the traditional way, that space where we dissected, where we worked, that space is all open. And that's why you put drains in it, because the fluid is going to collect and fill up that space. And over time, the drain removes that fluid. And then eventually, once that fluid gets to a small enough level, you take the drain out. It doesn't mean that there's no more fluid. The fluid's still there, but your body's now able to naturally absorb it. That takes about 2 to 3 weeks of a process. I bypass that, and immediately from day one of surgery, or you can call it day zero, regardless, on the day of surgery, you start to heal immediately because your tissues, I actually stitch them together so it's closed. So there's virtually minimal space for fluid to collect. And any little bit of fluid that's there, which is natural, your body's able to reabsorb it naturally, and you're fine. That's why it decreases your risk of seroma. And it makes your recovery so much easier, much faster, because you're not having to deal with drains poking out, pulling. It could be a source of infection and things like that. So much, much easier. So I don't do drains. I haven't done drains since I finished my residency training in 2016. So it's been 9 years now. I only do drainage tummy tucks, and my patients love it. And they come and see me for it, which is fantastic. Do you accept insurance? Do you use a long number? No, we do not accept insurance. The majority of these procedures are not covered by insurance. All of our patients pay out of pocket. We do offer financing options, so you can definitely take advantage of those as well, and we'll be happy to take care of you. I'm 5'3", 154, want to get lipo on the hip dips. Yes, absolutely. So you can come in, we'll do lipo 360, grab that fat, contour you, and then give you the fat and do the fat transfer to the hip dips. Kennedy Raquel, how much for this procedure? It's usually in the mid 20,000s, but specifically my patient coordinator will be able to give you more of an estimate for your budget, depending on what exactly you want to have done. What's the max BMI, Robin? Max BMI is 35. You're very welcome, Miss Brown Sugar. Thank you for participating. Again, like I said, send us a text. If we haven't responded to you, text us again, please, okay? Ripa, can you give me an estimate for a thigh lift and an arm lift? We will be happy to give you that estimate. Contact my office, 281-724-3138, and my patient coordinator will get that for you, okay? And niece heart, does insurance cover this skin removal? No, insurance does not cover it. Use a long number. I have lipedema, and all these procedures are covered by my insurance. Can I be a potential? Okay, if they're covered by your insurance, that's fantastic. It's very rare that insurances would cover these procedures at all. I don't take insurance. We don't take insurance. So if you want me to be your surgeon, absolutely, we'll be happy to do that. You'll have to make sure that your insurance accepts physicians who are out of network. As long as they pay also for out-of-network surgeons, that's fine. Then you will negotiate the reimbursement that they will reimburse you, and then you will pay us out of pocket, and then they will reimburse you directly. Yes. So you could be a potential candidate for that. Absolutely. Okay, Angie Markin, would you do a tummy tuck after a hysterectomy in the same operating room? I would not. The reason being is the hysterectomy, you have to open up the belly and go, unless they do a transvaginal hysterectomy, then yes, we can do the tummy tuck. But if they go through your belly area, usually it involves having to go through the belly area and remove those organs that are inside of you. I wouldn't recommend doing that at the same time. There are a few surgeons that would do it at the same time, but it's not the norm. Usually we'll separate those. Get your hysterectomy, heal from it, come back usually within 9 months, and then we can do the tummy tuck. It's mainly to reduce the risk of infection, bleeding, and also blood clots and things like that. So it's for safety reasons. How much for Lipo 360? Please contact my office. We will be happy to give you some estimates. Sharing things. Thank you for participating tonight. AFC XBN, hello from California. I love watching you live, but never joined before today. You explained very good. I appreciate the comment there, and thank you. If you're wanting to have surgery with us, by all means, come and see us. We'll be happy to take care of you. We do get plenty of patients that come in from California on the West Coast as well. Myra, do you use an ultrasound for a BBL? I don't. I know this past year, it's been the hot topic of using the ultrasound to be able to safely inject the fat. I've been doing the BBLs for 9 years now and doing it safely in the deep subcutaneous layer. Essentially, you want to be able to inject it in the right area. And the reason we're having plastic surgeons now use the ultrasound is to make sure that they are injected in the right area. I've been doing this for 9 years, like I said, and have been injecting in the right area just with feedback and knowing how to do it. The main thing is you don't want to go deep into the muscle or even deeper than that. And plastic surgeons used to do that, and that's what would cause the issues. So, but no, I don't use ultrasound for BBLs. My patients do extremely well with the techniques I use. Dr. Shanti, can thigh lift help clear stretch marks? Yes, as long as those stretch marks are within that area where I'm going to be removing the skin. And definitely will reduce the amounts of stretch marks that you have, even if it extends below. We'll pull out. It's kind of like the tummy tuck area. As long as your stretch marks are below your belly button, for the most part, we'll be able to remove all of them. Thank you for the questions. Miss Sia is asking, what is the muscle repair? So the muscle repair is what we do when I do the tummy tuck. Most patients who've had children or who've had some increased weight gain and have some separation of muscles. So we're talking about the abdominal muscles. So the ab muscles that go like this. You have two of them, one on each side of the belly button. They separate usually and get much, much looser to be able to allow for the baby to grow in the womb. And so that's normal. But when you deliver either by C-section or natural birth, not everyone will see that muscle separation get back to normal. So a lot of women will still have that separation of muscles. So it's kind of loose. So what I do is I fix that. So I bring those muscles back. So it gives you a much nicer function of your ab muscles. That's what the muscle repair is. Do you do any surgeries in a hospital? Very rarely. Yeah. So I will take a patient to the hospital when the patient has multiple comorbidities, and it's a lot safer to do it in the hospital setting because of their comorbidities. and we don't have access to all of those devices in the surgical facility. But 99% of my surgeries are done in the same-day surgical facilities. Taurus Goddess, I need a tummy tuck. Okay, wonderful. We'll be happy to take care of you. Send us a text message, 281-724-3138, and we'll get the process going. A lovely, what is the downtime? Downtime for these procedures, so for the body lift, you'll be weaning off your pain meds usually within 3 to 5 days. You're walking upright during that same period of time. And you'll typically be driving yourself in the office a week after. Most patients have already returned back to work, especially if it's remote work and desk type of work without any heavy lifting. Usually you'll get back to the gym around 2 to 3 weeks doing some light aerobic activity, walking on treadmill, things like that. And then you'll get back to light resistance training around 4 to 6 weeks, and then no restrictions by 8 weeks. So it's a fairly quick recovery with the drainage techniques that I use. What's the ballpark figure of these procedures? So mid 20,000s. The drainless tummy tuck is $13,000 to $15,000. We're currently running a special for a mommy makeover that includes the drainless tummy tuck and the FUBA repair and the breast lift for just under $20,000. And then the body lift, other procedures, you can add liposuction, you can do all that. It can vary, like I said, from $20,000 probably to about $35,000. It all depends on what you put in and how much you want to have done. They call me murder, says, sorry, I lost connection service. I missed your response about arm lipo. Yes, you can do arm lipo and lipo 360 at the same time. We can also include lipo of the thighs if you want to. Nadia, can you fix an umbilical hernia at the same time? Yes, we can. I've done it on patients before, so we can do the tummy tuck and fix your umbilical hernia at the same time. Maxine, hey, what is the age limit? There is no age limit. I've done these big body contouring procedures on patients in the 50s, 60s, and 70s, and they've done very well. The main thing is we need to make sure that your overall health is good, and so that we can actually safely put you under general anesthesia and get these procedures. I'm 47, and I'm able to, and I think I'm able to get anything. Let me see, where did the question go? I think I'm able to get anything done, but can I just get a tummy tuck? Yes. Nena Chavez, you don't have to get everything. We can tailor it to what area is bothering you and put together a treatment plan that will take care of that for you. Cola, I'm confused on a hip lift. Why not do lipo on the hip area? No problem. For this patient here, if I do liposuction here, she's already have sagging of her skin. Liposuction is going to remove that fat and it's going to make it even saggier. It's not going to give her this. You can't get to this result by doing liposuction on a patient like this. Liposuction removes fat. It does not remove skin. She has a lot of loose skin. She also has fat there, but she likes her fat. She didn't want to remove that. So we remove the skin. I pulled things up. That's the hip lift. I'm lifting it with surgery. Cut all of this out. Bring this point up here. And that gives her a very nice contour. That's the difference. Do you work on stretch marks, Grandma Jenny? Well, I will remove stretch marks with the tummy tuck or the body lift like this. If you have stretch marks in these areas, I will cut those out. Candy Apple 365. I want a tummy tuck and fat injections to my buttocks. How much does it cost? Great question. Please contact my office. My patient coordinator has those estimates. She'll be able to give you a budget. Duffy 29. How bad is the pain recovery? Everybody recovers differently, regardless of your pain tolerance. I want everybody's pain to be no more than 3 or 4 out of 10. 10 being the worst. 3 or 4, you kind of you are aware that you had something done. You maybe a little bit of discomfort here and there, but you're able to sleep well, you're able to eat, you're able to get back to your normal life activities. If your pain level is higher, say for example, a 7 or 8 out of 10, we need to adjust your medications, and we do that as needed. Like I said, everybody's different. I call all of my patients a couple hours after their surgery to check on them, verify how their pain is, answer any questions, and really guide them through all of that. And then you have direct access to myself and, of course, my office. And so we will be happy to answer your questions and guide you through getting your pain level just right for you. Price for a tummy tuck, $13,000 to $15,000 is our current price, and it will go up next year as we adjust the pricing to match kind of like the what the going rate is in the Houston area. Wonderful. So definitely get your surgeries now. You're going to be benefiting from the high discounts. All right, Casel takeout. Thigh lift dangerous. The thigh lift is not a dangerous procedure in the right hands. Just like the BBL is not a dangerous procedure in the right hands, or tummy tuck or breast lift or any kind of surgery. You have to make sure that you do your due diligence. I would recommend a board certified plastic surgeon who specializes in these procedures and does them regularly and safely. JS Free 2017, is the consult with you? Absolutely. When we do the consultation, either virtually or in person, you will be consulting with me. So like I said, I do these free live Q&A sessions every Tuesday and Thursday, time permitting, from usually 7 p.m. to about 8 p.m. So we'll probably take a few more questions and then we'll call it a night. But I do this to educate my community, my TikTok community, my YouTube community, and my Instagram community, mainly to get you guys information that can help you save tons of time sifting through misinformation on Facebook, internet, and other areas, so that you're well equipped to be able to go to a consultation, ask the right questions, pick your surgeon, and move forward with your surgery safely. We hope that you'll pick us. Oh, you're in Houston. Wonderful. Well, we'll be happy to see you. So come in and see us in the office. Yes, you'll be having a consultation directly with me. So for all of you who are getting a consultation, whether it's virtual or in person, you will be meeting with me. Milagros Burgos 381. Where are you located? We are located in Houston, Texas. If you're in the Houston area, we're in the River Oaks area, right by the St. Regis Hotel. Does the tummy tuck include liposuction? It does not, Teresa McCassell. But if you want liposuction, we will definitely be happy to add it. Not everybody wants liposuction. So the tummy tuck is just the tummy tuck, as in skin excision, muscle repair, new belly button, and I also always include the monsplasty, which is the repair of that fupa area. That is in all of my drainless tummy tuck techniques. So you get a wonderful result with repairing all of those areas at once. Hello, do you guys do payment plans? Yes, we do. We have 4 of them: Care Credit, Charity Financing, Alpheon, and Patient Fi. Please go ahead and contact us and we'll be happy to see you. Tika is asking, what's the cost for this procedure? It's usually in the mid $20,000, but contact us. My patient coordinator will be able to give you better estimates. I know the tummy tuck right now is around $13,000 to $15,000. We are running a special for mommy makeover that includes breast lift and a drainless tummy tuck with the fupa repair for just under $20,000. I had my muscles put back together, tummy just hanging. Would you recommend a tummy tuck? Yes, if you're having loose skin and it's overhanging, yes, I would recommend a tummy tuck. But again, I'd have to see you to be able to let you know what exactly needs to be done. Oh, wonderful. 709, Texas. That's one of my patients in her 70s, had a beautiful body lift surgery, did extremely well. She said she just went swimming today and had no problem getting into her swimsuit. Wonderful. Thank you so much for participating. Happy 4th of July to you and everybody. All right, let's finish up and wrap up here. I do have to call it a night. Rose Zai. Hi, where are you located? We are in Houston, Texas. What's the cost? Sorry if I missed the question. I think I just answered it. Maybe, hopefully you got it. It's usually, like I said, the mid 20s thousands. Contact us and we will be happy to give you some estimates for what you want to have done. Okay. How much does mommy makeover cost? Like I said, right now we're running a special for a mommy makeover at just under $20,000. It includes the breast lift, tummy tuck, and the monsplasty. So we'll be happy to take care of you. Use a long number, payment plans. Absolutely. We have 4 of them. Contact us. We'll be happy to take care of you and guide you through the process. Jasmine Reyes, I've lost 40 pounds. I want to lose another 20 pounds and reward myself for the tummy tuck or mommy makeover. Congratulations. Absolutely. Come and see us. Once you get to like much closer to your goal, like around 5 to 10 pounds away from your goal weight, we'll be happy to get you on the books and get you taken care of. Do you do patients who've had lipo before if they want lipo again? Yes, I do. So you can come and see us and we'll be happy to take care of you. Oh, what about men? Absolutely. I operate on men as well. So come and see us. We'll see what needs to be done and we'll be happy to take care of you. Jacqueline Cordova Chem, revisions, puppy dog ears. Yes, we do those as well. We'll do those under local anesthesia in the office. That's not a problem. Mommy Makeover, Rosai, come contact us. We'll see you. JS Free to 2017. I'm definitely making an appointment. Looking forward to taking care of you. Wonderful. Thank you so much. Pricing, please, guys, for pricing, send us a text message and my patient coordinator will be happy to answer you and give you some estimates. Maxine Hayes asking, do you work on diabetics? Yes, I do. I operate on diabetics all the time, and we make sure that everything is well and that they're doing well, so that there's nothing really contraindicative to having them surgery, to them having surgery. Do you need massages after lipo 360? Yes, yes. I typically will have my patients have a minimum of 10 lymphatic drainage treatments, usually 2 per week. Do you use general anesthesia on lipo 360? I do. Shireen thinks I do. Because with general anesthesia, I can be a lot more aggressive than with your wake. With your wake, it's very hard to get you comfortable. It takes much longer, and we can't be as aggressive as if we are, if you're under, yeah, if you're under local. All right, everybody, I do have to leave. So I wish everybody a happy Independence Day, 4th of July for those who are celebrating. Please contact us. We will be happy to take care of you. We are excited to always meet you guys in person, and we look forward to taking care of you, okay? Have a wonderful weekend, everybody. God bless you, and until next time, bye-bye.